When neck bones move too much, nerves and the spinal cord can be put at risk. Posterior cervical fixation is surgery that uses screws and rods to hold neck bones steady. Unstable motion increases nerve irritation and prevents reliable healing after decompression. The lateral mass is a thick bony area on each neck bone where screws can safely anchor. This area gives surgeons a safer path for screws, lowering nerve and artery injury risk. Understanding the anatomy helps explain when surgeons choose lateral mass screws. Next, let's cover common situations where fixation helps stabilize the neck. When wear affects several neck levels, it's called multi-level degeneration. In these cases, screws help keep the neck aligned after nerves are freed. But wear isn't the only reason surgeons add fixation. After a laminectomy, a surgery that removes bone, fixation helps prevent forward collapse. In trauma, screws hold fractured segments still, so healing occurs safely. Tumor or deformity can weaken bone, requiring secure anchors like lateral mass screws. Now that we understand when fixation is needed, let's look at how the screws are placed. The entry point usually sits slightly above and inside the center of the lateral mass. A correct start point prevents violating the facet joint, which could cause postoperative pain. The Anderson-Magral method angles the screw upward and outward to protect the nerve root. A nerve root is the nerve exiting the spine through a small opening called the foramen. A slightly outward angle increases distance between the screw and the exiting nerve root. When placing these screws, surgeons must protect two critical structures, the nearby nerve roots and the vertebral artery. Upper cervical levels often need a bit more upward angle to match natural bone orientation. Lower levels transition toward pedicle regions, so angles may slightly adjust. Pedicle screws offer strong fixation but carry higher risk than lateral mass screws. That's because they pass closer to sensitive nerves and blood vessels. If someone had surgery before, normal bone landmarks may be harder to see. In those cases, surgeons may use imaging guidance to place screws more accurately. Once screws are placed, rods link them into a stable construct that resists motion. In more complex cases, fixation may extend from the neck into the upper back. This adds strength when longer support is needed. Next, let's talk about how surgeons work to prevent complications. If a screw threatens a nerve or joint, surgeons may revise or redirect it immediately. Non-union means bones did not fuse, often requiring added support or extended fixation. Large studies show lateral mass screws have low nerve and artery complication rates when placed correctly. With careful planning and technique, posterior cervical fixation offers safe, durable stability for healing.